Recently, Riley Gaines did a video complaining about her medical bills. She recently gave birth to a baby. Congratulations to her and her family. Hope everything goes well with the kids. Sincerely, I'm a father of four myself. And she was complaining that months later she's still getting medical bills. And we were talking about the things that Joe Biden had done to help that out, and the things that Donald Trump had done to roll those back. And at one point in time, I said, "But universal health care will help take care of all of that." And Chad says the following: "Explain to us dummies about universal health care." I mean, actually, I should have said that with much more emphasis since there's an exclamation point behind it. But explain to us dummies about universal healthcare. And let's go back to basic math. Can we draw a perfect circle in universal health care? No, I don't think is why you are really mad at her. So I don't understand the perfect circle thing. Doesn't make any sense to me. And the reason why I'm mad at her is because she votes for and continues to support politicians who keep the current healthcare system in place, which is the reason why she's getting those bills. But I will give you what you asked for at the beginning of your comment. You said, explain to us dummies about universal healthcare, and let's go to basic math. Okay, let's go to basic math. Let's say we adopt the UK style of healthcare. All right? Get out a piece of paper and a pencil, and let's do the basic math together. Draw a line down that piece of paper. On the left side, you're going to put in there everything that comes out of your check for Medicare and Medicaid. Okay, those are two healthcare, governmental healthcare programs that you would no longer need to have deductions for, because we're going to include those the funding for that in the deduction for universal healthcare on the other side. On the left side, everything that comes out of your check for Medicare, everything that comes out of your check for Medicaid, the cost, your monthly cost of your premiums for healthcare. That is what you pay just to have your insurance. And then everything that you pay out of pocket once you have that insurance. Any deductible that you have to meet with your insurance company, any copay you have to meet to go to a physician or a specialist, anything that you pay out of pocket for your prescriptions, anything that you would have to pay out of pocket to go to a hospital, all of it. Okay? You add all of that on the left side of the aisle, along with everything that comes out of your check for Social Security. Because in the UK style, not only do they get their health care paid for, but they get a national pension, their version of Social Security. Add all of that up on the left side. On the right side, tell me what 10% of your gross pay is before any deductions, before any taxes, before anything. 10% of your gross pay. Do the math. Which one is bigger? For a very few people, it's going to be more beneficial to keep the existing system. For a vast majority, I'm going to say probably over 95% of the people in this country, it's going to be more beneficial to go to the UK style. You pay 10% of your taxes, of your gross income up front. 10%. That covers all of your medical care across the board. You go see a doctor, you go see a specialist, you go to the hospital, you have to take an ambulance, you have to have your spleen removed. Not only in this country, but in any country anywhere in the world that you go to, it's covered. Now, in some parts of the United Kingdom, they have to pay a small, like the equivalent to $10 out of pocket for prescriptions, and in other parts of the UK, they don't. But all your medical care is taken care of, and you have a national pension. And so you're no longer having any of the Social Security, Medicare, Medicaid, any of those deductions. You no longer have deductions for any of the healthcare programs or your retirement plan in exchange for 10% of your gross pay. That's what they're making work in other places. In Australia, it's even less. 10%. And then your employer kicks in a percentage of your pay. But you're not locked into that job wherever you go, whatever your employer is. And on top of that, if you adopt the UK style system, people who are on life-saving maintenance drugs, like insulin, don't have to pay that. People who are too old or below a certain poverty level, they don't pay anything. But yet everybody is still covered. The math is quite basic. It couldn't be clearer. We would pay less in healthcare costs overall in the United States of America, And we could start to get better results, because in these other countries, what they don't do here in the United States is they take a proactive approach to medicine. You pay 10%, your employer pays a certain percentage, 10, 15% of your salary, whatever it is, and the balance is made up by the federal government out of our general pooled tax dollars. And as a result of that, the federal government, in some of these countries, they push proactive styles of life. So, in other words, they're not telling people, yeah, go do whatever the fuck you want. There's a pill for that. They're saying you can go do whatever you want. Just understand that there are a lot of negative repercussions to that, but here's how you can live a healthier life. We could get better results, have longer lifespans, and pay less for our health care if people like you would get the fuck out of the way and allow politicians to be elected that could implement something that would literally change your life. But you're too deep into a fucking cult to allow that to happen. So I need to keep explaining basic fucking math to you like you're in third fucking grade.